Knock, knock. Hi, Jaxie. I'm Nurse Kristen, and good news, we're going to send you home. You and your baby home. So right here, I have your discharge paperwork. Okay? Okay, great. Yes, you and your baby are so cute. So before I hand this off to you, I'm just going to go through all the instructions, okay? So for you, Jaxie, because you're the mom, your diet is very important. So adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help with your bowel movements and to help them become more regular. You want to make sure that you're eating foods rich in calcium, which can include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non-sugar supplemental juices every day to satisfy your thirst and maintain hydration. You want to try to avoid soft drinks, coffee, tea, alcoholic beverages. So you might be asking, well, what can I do? We want to make sure that you're being active, but not too active. You want to gradually increase your daily activities until you're back into your normal routine. And make sure that you rest frequently. No lifting, pushing, or pulling for the first 2 weeks or as instructed by the doctor. And don't drive until you talk to the doctor. Usually we say don't lift anything heavier than like a jug of milk. So your breasts and nipples may have changed and or grown in size during your pregnancy. Make sure to wear something well fitted and supported day and night to help adjust to the changes. Wear breast pads until your breasts stop leaking milk. And then you can apply ice packs between feedings just to make sure that you're very comfortable. And if you decide to stop breastfeeding, kind of same thing, make sure you're wearing a supportive bra, and then try not to stimulate your breasts. Don't pump, and then make sure that you're using cold compresses with the ice or frozen towels for 15 minutes at a time. And then just try to stay away from some heat. So since you're breastfeeding, we want to try to give you some tips. I know the lactation consultant came in and everything was good, but you want just, some little tidbits. You want to make sure that the mouth of the baby forms a tight seal on your nipple. The baby's lips should be against the areola, not the nipple. And then if the baby is suckling incorrectly, you just kind of stick your finger up there and just pop the suction and try again. Typically, babies try to nurse around 10 to 30 minutes, but just go for as long as the baby wants. Good signs of nursing is that you'll hear your baby swallow without a clicking sound, seeing the ears wiggle or just a little bit of movement up here. You and the baby should be calm and relaxed during the feeding and feel a gentle tugging. There should not be any type of pain. If you do feel pain, it might mean that the baby's not positioned properly. And then just, like I said, just pop the seal and try again. Make sure that you're washing your hands very frequently and taking care of yourself. Always wipe front to back after using the bathroom to avoid infection. And then I know we gave you a peri bottle to use after you pee or poop, and that just kind of helps to cleanse with the warm tap water. So you're going to still have some bleeding coming from your vagina. It's going to decrease from bright red to a pinkish brown to a yellow or cream. Your period can occur as soon as 6 weeks from now or up to 2 months. So we also want to try to keep you regular so you're not constipated. So you can take a mild laxative or a stool softener if you need to, and just make sure to increase fluid and fiber in your diet. And then of course, birth control, it's kind of a misconception that you can't get pregnant while you're breastfeeding. If you're looking at some birth control options, it's always a good way. It's always a good thing to discuss with your healthcare provider, and you can choose to obtain a method before resuming like sexual activity. Speaking about sex, there should be no sexual activity and nothing should go up in your vagina for at least the first 6 weeks. After you leave here, it should be avoided until all the bleeding has stopped and you feel physically and emotionally ready. So we need you to report this back to us immediately if you have any pain, redness, warmth, swelling, drainage, or foul-smelling discharge. Any discharge that has a bad odor, severe headache or blurred vision, temperature over 100.4, or if you feel cold, feverish, kind of like you have the chills, if you have any thoughts of harming yourself or your baby, pain or burning sensation, redness, warmth, or swelling in the legs, get worried about you having a blood clot. If your breasts are painful, swollen, hot, itchy, or have sore spots with redness or streaks, with any type of flu-like symptoms, sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness, faintness, crying spells, mood swings that are out of control. You have to remember your hormones are kind of going crazy right now. If you're unable to empty your bladder, or if you find that you're peeing when you try to pee is very painful, difficult, or you're just peeing a bunch, you can maybe have a UTI, or if you're having issues going number 2. And then if there's any domestic violence or abuse happening, please call 1-800-96-ABUSE. So for your little one, safety is number 1. We want to make sure that you are placing your little baby, on his back to sleep with nothing in the crib. You want to use sleep clothing such as a one-piece sleeper instead of a blanket. Don't let anyone smoke around your infant. Use a firm mattress and safety-approved crib covered by just fitted seats. Car seats and other sitting devices are not recommended for routine sleep. Don't use pillow, blankets, bumpers, all up in there. No wedges or positioners either. All toys, including soft toys, need to be kept out of the infant's sleep area, and the baby should not sleep in the same bed as you. They can sleep in the same room, but not in the same bed. And avoid covering the infant's head because they can get hot really easily. Make sure to keep a bulb syringe. It's that thing in your bag. It looks like almost like a turkey baster. Near the infant at all times to clear the infant's throat or nose if necessary, and then to clean it, you just want to use warm soapy water after each time, and then allow it to air dry. Make sure you wash your hands before handling your child. All infants are required by law to be in a car seat while your car is in motion, and they should obviously be placed according to our state law, which is Florida. The use of outdoor announcements of your house, like signs or welcome home signs, we don't usually recommend that because they can call attention to an infant in the home. Be very wary of any unfamiliar person visiting your home or inquiring about your baby after you leave. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. If your baby starts crying, it's normal. Usually they cry because they're hungry, need a diaper change, or need to burp. Then you want to burp your baby after each feed. You just kind of tap them, kind of like this, like I'm burping you now. Yes. So calming techniques for your baby include feeding your infant, changing its diaper, gently rubbing the back or the tummy, walking your infant, rocking your infant skin to skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, just place your infant down in a safe place, take a break, walk away, and call a friend. Infants require a lot of sleep. You should be waking your baby. I'm thinking about you, Jackson. You should be waking your baby at least 3 to 4 hours for feeding. You should place your baby on his or her tummy every day for supervised tummy time. This will strengthen his or her abdomen, and plus it keeps them from getting that flat head. As far as eating goes, oh my goodness, there's so much to talk about. Since you're breastfeeding, you should breastfeed 8 to 10 times a day per the infant cues. Make sure to hold your infant close to you while you're feeding. Your infant needs to be cuddled, and skin-to-skin time is recommended. After feeding, make sure you keep your infant upright over your shoulder, and then just gently burp the baby. Make sure this thing's still going. Shit. Okay, yes, it's still going. Dang, it's going on forever. Okay, so you're burping the baby. You're not doing formula. As far as characteristics of the newborn, if they develop a rash, it's usually very normal. It appears like red, a small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve within its first week of life. Make sure to avoid lotions, powders, or perfume soaps. The baby has milia. Those are those white pearly bumps on the face, usually around the nose. Those disappear within a week. Jaundice is also very common, luckily. Your baby does not have jaundice, but just in case your infant starts to appear yellow, you need to call us immediately. As far as bathing, your child will need to be sponge bath until its umbilical cord falls off. You just want to use a soft, plain cloche wash, just water, and just gently wash your infant from head to toe, saving the diaper area for last. You can use like a baby shampoo if needed. Until that umbilical cord area falls off, make sure to keep it clean and dry. Inspect the cord and surrounding skin when you change a diaper, and notify your pediatrician if you have noticed any discoloration. Usually it falls off within the first 2 weeks. As far as diapers, 1 to 2 wet diapers are normal for the first day or two. Then you should expect to have 6 to 8 wet diapers or pale urine every day. Over the next few days, your infant's bowel movements will begin to change from yellow-green to mustard yellow, and then it will begin to soften. Your infant should at least have 1 bowel movement for every 24 hours. You might want to try to keep a log of the wet and dirty diapers just to keep an eye on their hydration and elimination status. You always want to wipe your female girl from front to back, and really make sure to cleanse all the crevices and folds to prevent diaper rash. Pat dry and diaper. It's normal for your baby girl to have white or pinkish discharge. That's very normal and will gradually disappear. Dress your child as you would yourself. Try not to overdress her, even though it can be so cute. All the little matching sets with the little sweaters and everything. Too much clothing and too many blankets can cause your infant to become overheated, but of course we do want to keep them also comfortable and warm. Vaccines, your infant should receive all of the recommended vaccines. And your pediatrician will be following up with you on that at like your first visit in a couple days. There are a couple warning signs you need to watch out for when caring for your newborn. Generally, if they don't pee within the first 24 hours at home, if there's no bowel movement at home in the first 48 hours, any rectal temperature above 104 or less than 97.5 needs to be called in or emergently visited an emergency room. Rapid breathing rate of over 60 breaths per minute or blue coloring that does not go away. Newborns typically can breathe in and out irregularly, but we definitely need them to be getting oxygen, you know what I mean? So you need to count the breaths for a full minute. There should be no pauses longer than about 10 seconds in between breaths. If you feel like they are retracting, or you feel like they're just really breathing really hard, or wheezing, grunting, or whistling sounds when they're breathing, that's a problem. You need to come in. If you notice any odor, drainage, or bleeding from the umbilical cord, yellow coloring the eyes, chest, or extremities, that could be jaundice. Crying, irritability, or twitching that does not improve with cuddling or comfort. A sleepy baby who cannot be awakened enough to nurse or nipple, or any signs of sickness, for example, cough, diarrhea, pale color, fever, all those good things. Or if your baby's appetite or suck becomes poor or weak, you need to make sure you call the baby's doctor. Do you have any questions? No? Alright, well here's your discharge paperwork and good luck with you, okay? Good luck. Alright. See you next time you have a kid. Bye.